Upper endoscopy, EGD. Upper endoscopy is a test that looks inside the upper gastrointestinal or GI tract. The GI tract includes the esophagus, stomach, and the duodenum, which is the first part of the small intestine. The test is also known as esophagogastroduodenoscopy, or EGD. It's done using a tool called an endoscope, which is a long, thin, flexible tube that has a light and a tiny camera. The test helps find problems such as ulcers, infection, or growths. It can show the causes of swallowing problems, nausea and vomiting, acid reflux, bleeding, and abdominal pain. Before the procedure. Before the procedure, you may have a physical exam, blood tests, or other kinds of tests. You'll be asked not to eat or drink for at least 8 hours before the procedure. Tell your healthcare provider about all medicines and supplements you take, if you have any allergies, and if you're pregnant or might be pregnant. Your healthcare provider will explain what happens during the procedure. He or she will also talk with you about any risks or complications that may happen. You'll be asked to sign a consent form that gives your healthcare provider permission to do the procedure. Read the form carefully and ask questions if anything is not clear. What to expect? An upper endoscopy takes about 20 to 30 minutes. When it's time for your test, you may be given medicine to help you relax or sleep. This is called sedation. This medicine is usually given through an IV line put in a vein in your arm or hand. Your throat may be numbed with a spray or liquid, and you'll be given a small plastic guard to protect your teeth. During the test, you lie on your left side. The endoscope is placed in your mouth and moved down your throat. Air is used to expand the GI tract, so your provider can see the lining more clearly. You may feel some pressure or discomfort from the air. The scope sends pictures of the GI tract to a video screen. Your provider looks at your esophagus, stomach, and duodenum for problems such as bleeding, inflammation, or growths. Using small tools inserted through channels in the endoscope, he or she can take small samples of tissue to send to a lab. This is called a biopsy. In some cases, your provider will remove small growths. The endoscope is then removed. After the procedure. After the test, you'll need to rest for about an hour to let the sedation wear off. This kind of medicine lasts for a while in the body, so you'll need a family member or friend to drive you home. Plan to take it easy for the rest of the day. If you had a biopsy, the results will be ready in about 7 days. Call your healthcare provider if you have any of the following: nausea and vomiting, vomiting blood, stomach pain that doesn't go away, black, tarry, or bloody stools, trouble swallowing, or fever. Things to remember. EGD is a test that looks inside the upper gastrointestinal or GI tract for problems. Small samples of tissue may be taken for testing. You will need to have someone drive you home. You will not be allowed to drive because of sedation. What we have learned. An upper endoscopy is done to look at the large intestine and colon. True or false? The answer is false. Upper endoscopy looks inside the esophagus, stomach, and the duodenum, which is the first part of the small intestine. You can drive yourself home right after the test. True or false? The answer is false. Because sedation lasts for a while in the body, you'll need someone else to drive you home.